Welcome back to my channel. If you're new here, my name is Neil Galve. I'm a registered nurse and I do have a degree in medical surgical nursing. I create nursing educational videos to help nursing students and nursing professionals like you with their studies. If that is something that you are interested in, consider subscribing. If you are already a subscriber though, thank you so much for your love and support. I see you. I upload my nursing educational videos Mondays, Wednesdays, and Fridays. Please make sure to subscribe now. You hit that notification bell so that every time I upload, you'll be the very first one to be in the class. Also, don't forget to give this video a big thumbs up and share with your friends because that will really help me know that you like to see more contents like this. Without further ado, you guys, let's jump into the video. Hi everybody! Kumusta kayo? Anong mga ganap nyo? Actually, just to be honest, I need to reshoot this video twice because I forgot to turn on my microphone on my first attempt. But anyways, I am here. Welcome back to another class. Kung akala nyo nakalimutan ko na meron tayong klase for today's video, nakalimutan, nagkakamali kayo dyan because I am here, and like you see on the screen, like you see on the title, this is all about Levophed. Another entry natin sa ating nursing drug study, nursing pharmacology. Now, if you haven't watched the other nursing drug study I created on my channel, I'll be putting the actual playlist link on the description box. Click the one out because I'll be putting it there together with the other playlists I have on my channel regarding, of course, nursing education. Or your second option is whenever the icon button pops out, click the one out because I'll be putting it there together with the other playlists I have on this channel. Before I further proceed, you guys, I would just like to grab this opportunity to really thank you for watching right now and being in class. You've been really obedient. You've been really hardworking student. And I love you, I appreciate you, and thank you for doing this for your future you. Your future you is thanking you right now for coming into class and learning something for today. And I'll make sure that it's going to be all worth it. The class discussion is always and will going to be amazing for you. And yeah, this is all about Levophed, and this is one of the common medications that we have in the ICU, one of the ICU drips that you probably commonly encountered. Sa mga estudyante dyan o sa mga nurses dyan na kailangan ng refreshment, hindi nyo pa nakikilala itong Levophed na to, this is now the time for you to be acquainted with this medication. Now, before further proceed, I would just like to grab this opportunity to thank you for always keep on supporting my channel. You guys, you've been really kind to me, and you guys have been sharing my uploads, my videos, following me on all my social media accounts. I've been having a hard time catching up, you guys. Take it easy. You guys are amazing, and I want to thank you from the bottom of my heart. Yes. And what else? Yeah, kung hindi mo pa ako pina-follow sa other social media accounts ko, I have basically everything. The link is on the description box. This video presentation is also going to be available on my Facebook page. It is Neil Galve. The link is on the description box as usual. And I have a 3 a.m. conversation, a podcast channel available on Spotify and Anchor. Please also check the one out because it's all about mental health and awareness, living your life to the best version you could ever have. Yes, it's all about that. And yeah, kung hindi ka pa nagsasubscribe bago tayo mag-proceed, nakakahiya naman sa'yo, mag-subscribe ka na. Okay. Eto na, magsisimula na tayo sa ating discussion. Let me introduce to you Levophed. Now, this is in the class sympathomimetic. Now, this is your thorough nursing study guide sa iyong Levophed. Now, magsimula na tayo ha. Levophed, or tinatawag nating norepinephrine bitartrate, is a vasoconstrictor similar to adrenaline used to treat life-threatening low blood pressure o yung tinatawag nating hypotension that can occur with certain medical conditions or surgical procedures. Levophed is often used during or after CPR, cardiopulmonary resuscitation. Levophed is also available in generic form. Alright? So huwag kayo mag-alala kasi I got you guys. Magsimula na tayo. Let me share to you the objectives. Okay, so today we're going to discuss classification, generic, brand name, route, and dose. You're also going to expect that on this class, we're going to have the following: mechanism of action, indications, warning, and precaution in administering your Levophed, side effects, and of course, this will not be your nursing drug study if we're not going to talk about your nursing responsibilities. You guys ready? Let's proceed. First up, classification, generic, and brand name, route, and dose of administration. Hingang malalim, eto na tayo. Okay, very easy, very straightforward. Let me start with the classification. This is a sympathomimetic type of medication. Sympathomimetic meaning it mimics the sympathetic effect. Wherein everything, ano yung sa sympathetic effect, sympathetic nervous system natin, everything goes up except for GI and GU. Right? Oh, kung ano dyan, kunwari hindi mo alam, hindi, alam mo yan. Kaya classification niya, sympathomimetic. It mimics the sympathetic nervous system, wherein everything goes up except for GI and GU. How about the generic and brand name? This goes respectively norepinephrine and Levophed. So norepinephrine is your generic, and then your brand name is Levophed under the trade name Levophed. Now, route and dose of administration. Makinig ng mabuti. This is available in injectable solution. Normally, makikita mo siya 1 milligram per ml. Dosage concentration should be given as follows. It depends on a certain condition and clinical, clinical condition of your patient. Nilista ko dito, mapapansin nyo dyan, palitan ko lang. Nakadepende sa kung anong klase ng disorder or condition ng pasyente mo ang route and dose. So meron tayo dyang acute hypotension, cardiac arrest, sepsis and septic shock, beta blocker toxicity off-label, calcium channel blocker toxicity off-label, tricyclic antidepressant toxicity off-label. Huwag ka mag-alala kasi iisa-isahin natin sila. Let's start with your acute hypotension. Ano ba ang route and dose of administration mo when you're treating acute hypotension? Acute meaning less than 6 months of having acute or having hypotension. According yung acute and chronic hypotension nakadepend, yung definition na sinasabi ko ng acute and chronic is based from NANDA. According sa NANDA, you will say that something or a condition is acute. Let's say, for example, pain. You will say that it is acute type of pain if it is less than 6 months long of, that the patient is enduring it. Or you will say that the pain is chronic if it is more than 6 months. So, nakadepende ito sa saan? Sa duration. But in this case, we're talking about acute hypotension. So, hinati ko siya sa dalawa. The dose and route of administration for acute hypotension for adult patients. Initial dose, makinig, 8 to 12 microgram per minute intravenous. That's the route. IV infusions nga po ito, and then you have to titrate to effect, which is maintenance niya is 2 to 4 micrograms per minute IV infusion. Alright? That is the maintenance, 2 to 4 mcg, micrograms per minute IV infusion. Sa pedia, paano naman? Ang initial dose mo when you're starting the infusion is 0.05 to 0.1 micrograms per kg per minute. Nakadepende sa weight ng pasyente mo, mcg per kilogram per minute, IV infusion. Yes, IV infusion nga po ito. Then you have to titrate to effect at a maximum dose of 1 to 2 micrograms per kilograms per minute. Malinaw ba tayo sa acute hypotension when it comes to a route and dose? Absolutely. Mag-proceed na tayo. Cardiac arrest. Sa mga pasyenteng may cardiac arrest, sa adult, the initial dose is 8 to 12 micrograms per minute intravenous IV infusion. You have to titrate to effect to maintenance level, which is 2 to 4 micrograms per minute IV infusion. The initial dose naman sa mga pedya na may cardiac arrest, initial dose is 0.05 to 0.1 micrograms per kilogram per minute intravenous infusion. Titrate to maximum effect of or to maximum dose of 1 to 2 micrograms per kilogram per minute. Okay? Malinaw, malinaw. Huwag mag-alala because if you're watching this video lecture sa YouTube, I'm going to put the timestamp chapters para balik-balikan mo kung saang area ka nahihirapan. Okay? So, how about for sepsis and septic shock? How about the route and dose of administration sa mga pasyenteng may sepsis? Okay, sa adult, 0.01 to 3 micrograms per kilograms per minute intravenous IV infusion. Sa pedia, 0.05 to 0.1 micrograms per kilogram per minute IV infusion. You have to titrate to effect not to exceed 2 micrograms per kilograms per minutes. Okay? Diyan naman siya sa harapan mo, basahin mo. Ano naman ang beta blocker toxicity off-label? Now, this should be titrated to age-appropriate blood pressure. So, nakadepende ito. When you're treating beta blocker toxicity, you need to titrate it to the appropriate blood pressure per age. Okay? Sa calcium channel blocker toxicity off-label should be titrated to age-appropriate blood pressure. Tricyclic antidepressant naman toxicity off-label should be titrated also to age-appropriate blood pressure. Once again, this is your classification, generic and brand name, and route and dose of administration of your Levophed. Mag-proceed na tayo. Okay? Mechanism of action, nurses. Paano nga ba? Paano nga ba ang mode of action ng medication na ito? Makinig na mabuti. Eto na tayo. Alright, so norepinephrine acts predominantly on alpha adrenergic receptors to produce constriction of resistance and capacitance vessels, thereby increasing systemic blood pressure and coronary artery blood flow. Now, this medication is naturally occurring catecholamine potent alpha-1 and beta-1 adrenergic effects, making it a strong arterial and venous constrictor. Increased blood pressure and cardiac output by stimulating alpha adrenergic receptors in the blood vessels demonstrate minor beta activity. Once again, you guys, this is the mechanism of action of your Levophed. Basically, sympathomimetic effect. Everything goes up except for GINGU. Okay, vasoconstrictor. So, vasoconstrictor to increase the blood vessels, thereby increasing blood pressure. Alright, mag-proceed na tayo. What is the indications? Kanino mo ibibigay ang Levophed? Kanino? Dito. Ito siya. Levophed is indicated to raise blood pressure in adult patients with severe acute hypotension and shock. Period. Sa mga mabababa ang BP sa ICU, kadalasang ICU drip nila ito. Okay? Severe acute hypotension and shock. Okay, Doc? Simple. Bago tayo mag-proceed sa warnings and precautions, kung hindi ka pa nagsasubscribe, nakakahiya naman sa'yo, mag-subscribe and hit the notification bell. Ang bilis lang noon. Yay! Okay, eto na tayo sa warnings and precautions. Makinig ng mabuti, nurses, because I'm gonna give you a thorough discussion about the warnings and precautionary measures when administering Levophed. Alright, let's begin. So, risk of tissue ischemia. So, patients who are receiving Levophed, there are risk for tissue ischemia. Avoid in those with mesenteric or peripheral vascular thrombosis, occlusive or thrombotic vascular disease, prolonged or high-dose infusions. Avoid abrupt cessation. Hindi agad tayo discontinue ng Levophed. Tapering po ito. Avoid abrupt cessation o yung pagtigil. Kailangan nire-regulate. So, withdraw gradually by reducing infusion rate. Alright? Risk of cardiac arrhythmia especially. Saan? During hypoxia or hypercarbia. Perform continuous cardiac monitoring in those with arrhythmias. Kaya nga po naka-Q1 tayo sa ICU. Avoid extravasation. Okay? Sa mga pasyenteng nako, kadalasan ito binibigay sa may mga central line, hindi ito sa peripheral line kasi risk for extravasation ito. Asthma patients, sulfite sensitivity. Sa lahat may mga allergic sa sulfites. Derivatives, bawal sa kanila ito. Sa elderly naman, precautionary measure, avoid infusion into leg veins. Why? Because for the risk of thrombosis. Pregnancy, bawal siya because it can cross the placenta, and also for nursing mothers. Once again, these are the precautionary measures and warnings. Whenever you administer, whenever you administer Levophed, makinig ng mabuti ha, dahil eto na tayo sa side effects. So common side effects of norepinephrine include the following. Eto na nurses, slow heart rate, high blood pressure, o yung tinatawag nating hypertension. Ano pa? Irregular heartbeats o yung arrhythmias, confusion, anxiety, shortness of breath, SOB, with or without respiratory difficulty, headache, nausea and vomiting, sweating, tremor, restlessness, urinary retention, leakage of intravenous IV. Kaya nga risk ito sa saan? Extravasation, gangrene, dizziness, weakness, redness, and swelling at the injection site. Extravasation. Nako, malapit na tayo matapos. Bago tayo mag-proceed sa iyong nursing responsibilities, paalalahanan lang kita. Like, share, and subscribe to my channel. Okay, doke. Eto na tayo sa nursing responsibilities. Ito na yung pinaka-core ng ating drug study for today's video. Alright. So, I list down 5 major things that you have to do as a nurse whenever your patient is having an ongoing infusions of Levophed. Okay. So, first up, monitor BP continuously if possible or every couple of minutes. Double check all concentrations with additional nurse. Ito yung tinatawag nating double independent checking. Okay, may result in rebound hypotension due to tissue ischemia when discontinued. Hence, you will do tapering when you try to wean the patient off from Levophed. Monitor EKG and CVP, central venous pressure. Pressure. Ano ba? Bisaya ako manday. And lastly, if patient is awake, instruct them to report any signs such as headaches, dizziness, or chest pain. Okay, dope. Thank you so much, you guys, for watching. I hope you like this one. I hope you learned something, actually. Please like, share, and subscribe to my channel for more nursing educational videos. Let me know if you have other nursing topics that you want us to do. You comment it down below. Abangan nyo nga yung upload natin this coming Friday because it's going to be amazing. It's going to be fun. And you guys, tulungan nyo na nga ako, ipamalitan nyo na sa radyong sira ang pinakabago, pinaka-fresh at ang pinaka-libreng nursing review center sa balat ng YouTube. And don't forget to follow me in all my other social media accounts. Everything is at Neil Galve, except for my TikTok account, which is Neil Galve Official. I have a Facebook page, it's Neil Galve, and I do have a podcast channel, it's 3 a.m. Conversation with Neil Galve. So, I will see you again on Friday, and you have a good one. I love you.